So again, it depends on whether we're doing skin on or skin off cross-linking. It's very different recovery. So we'll start with the traditional skin off. So that's obviously a bit slower. The skin is removed, so it takes about a week for the skin to regrow, and a contact lens is placed on the eye during that procedure. And then usually the vision improves around the 1 to 2 week mark. And then usually there's fluctuations for the first couple of months. Patients definitely can't drive for the first 1 to 2 weeks. And there's quite significant discomfort, I would say, for the first 24 to 48 hours. And that reduces very quickly with the application of our contact lens, but also just because it passes pretty soon after. So that's your traditional epithelium off. Epithelium on, which a lot of patients opt for, is much, much different. Because we're not removing the skin, the vision will be a little bit blurry, but nothing like epithelium off. Again, you'll still get visual fluctuations for the first 3 months, but assuming that patients meet the driving guidelines in the first place, you've got to remember that lots of our keratoconus patients actually aren't suitable for driving. Depends how early in the piece that their keratoconus has been picked up. But assuming that with corrected vision they are able to drive, then epithelium on you can drive within 24 hours, assuming that the corrected vision passes the legal driving requirements. There's only a little bit of discomfort on the first night, but no severe pain. And patients can get back to work within a few days. It's very different. So yeah, there's different process, different procedure really, but same outcome.
And so patients should, of course, really avoid eye rubbing or swimming or any other daily activities.
Yeah, so I mean, usual post-operative. So if you've had epithelium off, you can't swim for a few weeks, and no one should be rubbing their eyes in general. But definitely not post-surgery. And anyone who's got keratoconus shouldn't be rubbing their eyes. They need to be really mindful of how they're sleeping on their pillow. And we get them to use drops for a period of 6 weeks and to lubricate a lot as well.
Would they wear a patch at night, like with cataract
so we
surgery?
give all our patients plastic shields when they're sleeping for the first week at night. Even the epithelium on, I recommend patients use them for a few days because they've still had 2 different types of chemicals put into their eyes. So with the epithelium on, we use 2 types of chemicals. The first chemical aims to penetrate through the skin, and then the second chemical does the treatment. So you're still going to be a bit uncomfortable, and you might accidentally rub your eyes when you're sleeping. So we still get patients to use a plastic shield. I think that's just sensible. And obviously sunglasses when you go outside for the first week or so. But again, everyone should be wearing polarized sunglasses all the time when they go outside.
That should be a default anyway.
Yeah.